The Madness of King George, Meghan Markle edition. Did you know that the Meghan Markle scandal has been drawing comparisons to the historical madness of King George? Stay tuned to unravel the shocking parallels. Hello and welcome to the channel. In today's video, we delve into the controversial Meghan Markle situation and its unexpected resemblance to the madness of a bygone royal. In my last major post on Meghan Markle, there were many comments from you about why my hypothesis on the mental health of Meghan Markle may not be as much of a flight of fancy as one may think. I thank you for these brilliant comments, which make me think deeper about mental health in general. Despite the odd comment questioning my own mental health, I persist in my stance on the disturbing behavior of Miss Markle. I stand my ground because there is some medical evidence for what I say. Not overwhelmingly, granted, but there is some. Again, not to be unkind, that is not what I am about. The goal of this whole channel is to educate about health, which is my passion, hence my choice of profession, and find solutions to health problems, be they global or individual. A mental health problem is not something to be ashamed of. Yes, there is much that shocks us, but it has to be recognized for what it is if something is to be done about it. Commenter Dingle reminded me of something I enjoy doing and sometimes serves me well in my professional life. Dingle says, well, Mad King George started out acting like a narcissist. Tantrums, unreasonable demands, blurting things out randomly. Dingle reminds me of my penchant for rare diseases. If you have ever watched the film The Madness of King George, you will know that King George III was, well, mad. No insult to him. That's just what it is. Moreover, he had a rare disease called porphyria. I have mentioned porphyria somewhere on this channel before. I just can't remember where. First person to find it for me gets a shout out. I like thinking out of the box. And sometimes, as Mrs. Neanderthal points out with her comment in this video, sometimes it's not a duck. Her comment says, your duck story is similar to the aimless Dunlos analogy. If a doctor hears hoof beats, don't necessarily think horses. That's why the zebra is the Ehlers-Danlos emblem. So true. Sometimes it really isn't just a duck. If King George lived in today's social media age, epoch, there would be many videos about him for sure. In fact, I strongly suspect he was the Meghan Markle of his day, so to speak. The typical symptoms of porphyria are severe pain in the belly, chest, legs or back, digestive problems like constipation, nausea and vomiting, muscle pain, tingling, numbness, weakness or paralysis, red or brown urine, and this is often what brings the patients to the doctor. Mental changes such as anxiety, hallucinations, mental confusion, and, as Dingle mentions, narcissistic personality disorder. In his day, King George was simply known as the Mad King. Modern medicine, however, makes a retrospective diagnosis on him, and today medical students all over the world think of him not as Mad King George, but the best high-profile case of porphyria. I know I did. only ever had 2 patients with porphyria in my entire career so far. So yes, it is a very rare disease, but an important one in the diagnosis of someone who has personality or psychiatric issues. In the context of my video on possible organic brain changes in Meghan Markle, I did not mention porphyria. This is an omission and a crime against my own mantra of thinking outside the box. I am therefore grateful to Dingle for bringing me back to my center position. And yes, porphyria does cause organic brain changes. The neurological manifestations of porphyria include cranial neuropathy, peripheral neuropathy, autonomic neuropathy, sensory loss over the trunk, as well as rare cerebellar, basal ganglia, and pyramidal tract involvement. In other words, it does cause organic brain changes. Mad King George was given an organic or physical diagnosis literally centuries after his frankly psychiatric antics. In the search for a diagnosis, leave no stone unturned. Look until you can look no further, even if it takes years. The bizarre antics of Miss Markle are remarkable indeed. The narcissistic behaviors, the clinging to initially, and now the pushing out of the way of Prince Harry, whilst in full view of world stage cameras on public outings. Unbelievable. The ever-desperate attempts to remain in the public conscience despite all the mounting evidence that she is not as desired as she previously was, spells a kind of delusion that only saddens the observers who can see the desperation from the point of view of the sufferer. The frankly cruel treatment of the elderly father in an exaggerated, perceived sense of having been slighted by him, the constant accusations against the British royal family. It's not funny, and it's certainly not pleasant to watch for the silent observer like us. When will something be done to help this woman? King George III, even in the 18th century, was assigned a physician as things got worse for him. Modern medicine is even less judgmental and more humane now than it ever was. Victorian freak shows are not supposed to exist anymore, but here we are in the midst of a rather long one. Do keep your comments coming. I am only asking questions, but in so doing, I am learning. Join me in learning about all kinds of ailments, acute or chronic, and by all means, always feel free to ask a doc.